Know the top stories of the day. Understand the issues that matter. This is Manila Bulletin News on Web. Your quick rundown of top news in the country and around the world. Manila Bulletin, celebrating 120 years of timely stories and timeless truths. Be fully informed. Hi, I'm Barbie Atienza. This is MB Now, and here are your news on web. The Octa research group said the implementation of the enhanced community quarantine in the National Capital Region Plus was effective. In a radio interview, Octa fellow Dr. David Guido said the ECQ has brought down the reproduction number in Metro Manila from 1.88 to 1.24. While there's no flattening of the curve yet in the NCR, Guido said Octa is expecting a downward trend in cases by next week. Guido also said the one-week growth rate in NCR went down to 16%. The expert said that while NCR was already placed under a less restrictive quarantine level, Octa still sees a continuous decrease in NCR's reproduction number. On Sunday, Malacanang placed the NCR Plus under the Modified Enhanced Community Quarantine, or MECQ, from April 12 to April 30, 2021. The effects of the 2-week ECQ imposed in the NCR Plus may be felt in 2 weeks' time. Department of Health Undersecretary Maria Rosario Vergere made a statement after the government downgraded the restrictions imposed in NCR Plus to less strict MECQ until the end of April. The health official noted that what would be the most pressing matter to consider right now is the healthcare utilization in hospitals and the medical interventions provided to patients. Vergere has also defended the implementation of the 2-week in NCR Plus, or a 2-week ECQ in NCR Plus, saying that it is not really accurate to say that a 2-week ECQ was a waste. The DOH official had this to say in reaction to the statement issued by the Healthcare Professionals Alliance Against COVID-19, saying that the government still has no clear plans and efforts to fix the root causes of the health crisis in the country. Amid the gloomy pandemic situation, the country has reached a new milestone in its efforts to fight the COVID-19 as the total number of administered vaccine doses breached 1 million mark over the weekend, according to vaccine czar Carlito Galvez Jr. Sunday night, April 11. Galvez, chief implementer of the National Task Force Against COVID-19, said a total of 1,137,534 vaccine doses were already administered as of 6 p.m. on Saturday, April 10. The feat was achieved a month and nearly 2 weeks after the government launched its free inoculation program on March 1. Galvez made the remark as the national government received 500,000 doses of CoronaVac vaccines that were procured from Chinese firm Sinovac Biotech. For the month of April, a total of 1.5 million procured Sinovac vaccines are expected to be delivered to the country by China. The remaining balance of 1 million doses are set to be shipped by the end of the month, according to Galvez. Meanwhile, an additional 2 million doses of Sinovac vaccines will arrive in May. The deliveries are part of the 25 million vaccine supply secured by the government from Sinovac. Galvez said the government has focused the allocation of the vaccines in areas with the highest infection rates. While administering over 1 million vaccines is a laudable act, the government has still a long way to go in achieving its target of inoculating 50 to 70 million within the year to achieve herd immunity. To achieve the goal, Galvez had said that the government aims to inoculate 500,000 to 1 million people weekly in April or May, and possibly more in the third quarter. The vaccination program may pick up its pace in the second or third quarter of 2021 once the bulk of supply of the purchased vaccines arrive. In June, a total of 10.5 million vaccine doses are set to arrive in the country, 13.5 million in July, and 20 million each from August to December. In Metro News, Malapitan asks constituents to maintain vaccine trust. Quezon City government partners with Red Cross to boost COVID-19 mass testing. And San Juan City kicks off vaccination of senior citizens with Sinovac. More from this report.
Caloocan City Mayor Octa Malapitan has called on his constituents to maintain their trust in the COVID-19 vaccines after the Department of Health concluded in its investigation that a 54-year-old male resident who suffered a stroke was not directly connected or caused by getting the Sinovac vaccine. Malapitan said the local government is ensuring the safety of those who are getting vaccinated by requiring them to undergo screening, counseling, and monitoring. The DOH and the Food and Drug Administration said that after conducting an assessment of the patient, the COVID-19 vaccine did not cause the stroke. The adverse event inconsistent with the causal association of the vaccine and the adverse event coincidental to the underlying emerging conditions of the patient. The DOH and FDA strongly emphasize that vaccines are safe and effective in affording protection against COVID-19 and in preventing the severe form of COVID-19, according to DOH Sunday's statement. The Quezon City government and the Philippine Red Cross have signed an agreement allocating 8,000 RT-PCR test kits for the expansion of the city's COVID-19 mass testing. Belmonte also said the partnership will allow the city government to test more residents and reinforce contact tracing efforts. The local government is also planning to open additional testing centers that will cater to individuals who are flu-like symptoms and those who have exposure to COVID-positive patients. The city government also inked a partnership with a private diagnostic clinic that will lend 2 mobile X-ray units to the city. The X-ray units worth 3.6 million pesos each will be set up in 2 of the Hope facilities. The San Juan City government kicked off on Monday, April 12, the inoculation of its senior citizens with Sinovac Biotech-made Coronavac vaccines after the Food and Drug Administration allowed its use for 60 years old and above last April 7. Zamora added that the city's supply of AstraZeneca vaccines has run out, which is initially offered to both healthcare workers and senior citizens. The local government said that it has received another 1,000 doses of Sinovac vaccines from the national government, augmenting its dwindling supply of Sinovac as acceptance of the China-made vaccines increased in the past weeks. As of April 11, 51,419 San Juaneños have registered with the city's vaccination registry, or 60.21% of the target population of 85,400.
Here are the top news in other parts of the country. Bacolod City and Negros Occidental require travelers to register in S-Pass. 71 families displaced by flash flood in North Cotabato. And DOST conducts training for rubber farmers in Zamboanga Sibugay. Here are the details.
Travelers to and from Bacolod City and Negros Occidental are now required to register in the Safe, Swift, and Smart Passage or S-Pass Travel Management System, a one-stop online communication and coordination platform for travelers and local government units. According to the City Health Office, Bacolod is already implementing the use of S-Pass and will stop the online issuance of medical certificates for travel after April 15. The province of Negros Occidental is also utilizing the S-Pass travel management system for travelers and the StaySafe.ph as official social distancing, health condition reporting, and contact application system of the province. Inbound travelers should secure an electronic or printed copy of the approved travel coordination permit issued by the S-Pass. 71 families were displaced by a flash flood brought by heavy rains in 3 low-lying villages in Maquilano, North Cotabato over the weekend. According to the Municipal Disaster Risk Reduction and Management, the affected families are currently sheltered at designated evacuation centers in the municipality. Based on the initial MDRRMC report, a portion of the newly built dike on Malasila River in Barangay Bulacanon collapsed, resulting in the water overflow and submerged portions of the 3 adjoining barangays. The Department of Science and Technology Forest Products Research and Development Institute has conducted a series of training for rubber farmers in Naga, Zamboanga, Sibugay to help them produce high-value furniture, moldings, and joineries from senile rubber wood trees. 78 members of the Tambanan Agrarian Reform Beneficiaries Multipurpose Cooperative attended the training from harvesting to furniture making and basic finishing. Old rubber wood trees in the community can now be made into premium products like furniture, doors, door jambs, and other builders' woodworks that will bring in much-needed income to the farmers.
In world news, South African COVID variant better at bypassing Pfizer-BioNTech jab, according to an Israeli study. India bans export of COVID-19 treatment drug remdesivir. And Buckingham Palace well-wishers accept scaled-down funeral plans for Prince Philip. Let's watch this report.
The South African coronavirus variant is better at breaking through the defenses of the Pfizer-BioNTech vaccine than other forms of virus, according to an Israeli experts. However, one of the authors told AFP that while the study showed the variant to be relatively successful in infecting vaccinated people, it did not provide any data on whether it could generate serious illness among vaccinees. The study by Tel Aviv University and Clalit Health Services, Israel's largest healthcare provider, compared 400 unvaccinated people infected with COVID-19 to 400 partially or fully vaccinated people who also had the virus. Two studies published in February in the New England Journal of Medicine conducted by principal vaccine manufacturers Pfizer-BioNTech and Moderna showed that presence of antibodies after vaccination was less pronounced in people exposed to the South African variant, indicating diminished protection. The Israeli study was the first real-world assessment of the South African variant's ability to bypass a vaccine. India on Sunday banned the export of remdesivir as infections soared to a new daily high and hospital grappled with increased demand for the coronavirus treatment drug. The health ministry said the surge in cases had led to a sudden spike in demand for the antiviral drug. Remdesivir, made by US pharma giant Gilead, was one of the first drugs to show relatively promise in shortening the recovery time for some COVID-19 patients, but World Health Organization-backed studies had said that the drug had little or no effect on COVID-19 mortality. The ban came as India's wealthiest state, Maharashtra, which has been the main driver of the infection spike, explored announcing a complete lockdown from as early as Monday. Well-wishers continue to visit Buckingham Palace to pay their respects to Queen Elizabeth II's husband, Prince Philip, who passed away on Friday, April 9 at the age of 99. A steady stream of people continued to lay off flowers by the palace gates on the third day of national mourning, despite royal family requests not to gather at Royal Palace because of the restrictions. Several people say they understand the need for a pared-down private funeral due to coronavirus pandemic. The funeral of Prince Philip will take place next week, according to Buckingham Palace, announcing a stripped-back ceremony due to coronavirus restrictions and returned for exiled royal Prince Harry but not his wife, Meghan.
In entertainment, K-pop girl group Blackpink's Rosé has set 2 new Guinness World Record titles through her solo debut single album R, containing the songs On the Ground and Gone. On the Ground peaked at number 1 on the Billboard Global 200, dated March 27. This makes her the first artist to reach number 1 on the Billboard Global chart as a soloist and as part of a group. Rosé also set a Guinness World Record title through the On the Ground music video, the most viewed YouTube music video in 24 hours by a solo K-pop artist with 41.6 million views. This surpassed a record set by Korean rapper Psy's Gangnam Style, which racked up 36 million views. And in sports, group workouts of pro teams and training of national athletes will remain prohibited even in Metro Manila, and provinces inside the NCR Plus bubble were placed under a looser modified enhanced community quarantine guideline on Monday, April 12. Only individual activities are permitted as per MECQ regulations of the Joint Administrative Order crafted by the Games and Amusements Board, the Philippine Sports Commission, and the Department of Health. Concerned athletes will have to wait a little longer before NCR Plus can return to general community quarantine, which allows practices with observance of strict health protocols in training bubbles. The new guidelines, however, allow solo activities outdoors like walking, running, jogging, and biking, provided that physical distancing is observed. And those are the news on Web today, April 12, 2021. For more news and details, get your copy of the Manila Bulletin newspaper tomorrow or log on to www.mb.com.ph. You may also subscribe to our newsletter through the link in this video's caption to have the day's latest news delivered to your inbox. I am Barbie Atienza for Manila Bulletin. Join us again tomorrow. This has been MB Now. Be fully informed.